Hello again, it's Ian at Sambhavna in Bhopal. It's the 10th of February 2020. It's Monday, so I apologise for not posting this on the Sunday as I usually do, but I was a bit busy on the Sunday, that's my excuse. I'm here sitting with Nitesh Dubey, we usually call him Nicky, who works in the registration room and system in Sambhavna. And as you can see here, this is one of the computers that they use and the window where people will come in and register their attendance. And every patient has a book, and we keep a records both on the computer and and in their books as well. That's my camera just collapsing. Here we've got a measuring stick, so they also take measurements of the people, and right round behind me, if I go slowly enough so that you don't get dizzy, we will see a very fancy electronic scale. I can get round there, there we go, which tells me yesterday that I was at actually about 71.2 kilograms, which is good for me. So sitting with me, as I said, is Nitesh, or Nicky. And you've worked here for quite a long time, I think, Nicky.
Yeah. 2009.
2009, yeah. So it's 10 coming up to 11 years you've been here. So maybe I can show our viewers the... I'm just going to put me off the camera for a minute. All these storage boxes, and maybe you can tell what's in these storage boxes and what the basic work of the registration team is, because you've got Shweta with you and Nagesh, yes?
Yes.
Yeah.
The hard copy.
And so these are all hard copies.
Yes.
Of the
some information on gas exposed and contaminated water exposed person.
Okay, so you classify them differently.
Yeah.
You have different records for those that are just exposed to the gas and those to the
contaminated water exposed, and both and unexposed.
Okay. Unexposed. So what unexposed people?
Means research department record.
Oh, I see. Okay, so the research department is actually doing research on people who are not exposed.
Yes.
And that's interesting. I didn't know that. So that's really, that gives them a comparison, I would think, of what's going on.
Yes.
So how many in 2020 now, or 2019, last year, this year, how many new patients are you getting previously unregistered?
Total registration and department.
What's the total number of people that you've had through the clinic?
Yes. 35,000.
That's 35,000.
Yes.
And how many new people do you get, say,
daily,
in a week?
Daily 10 to 15.
10 to 15
new people.
Here.
Yes, come here.
Come here.
Different gas exposed and community water exposed.
Yeah, I get that. So
different category.
Because that was something I noticed, that has that gone up in recent years, that number 10 to 15? Yeah, I wondered, because I noticed last year and indeed this time when I've been working here, I seem to see lots of people. I had 2 new patients today, and they were both recently registered. You know, one last year, back end of last year.
Two and 3 people daily registered. Daily.
Yeah.
And different pathy.
Yeah.
Ayurveda and allopathy.
Yeah. Yes. So that's quite a large number still coming through.
Yes.
We
but
haven't
new patient
seen
is
before.
Come daily 10 to 15.
Yeah. That's really interesting. So tell me a bit about yourself, because I think you were a little baby in 1984. I think you said to me earlier.
No, I born in 1989.
1989. Okay, so you came after that. Sorry, I'm estimating your age a little bit more than it is. So your parents must have been.
My mother is also gas exposed.
Yeah, she was living near to the.
She was living Shahjahanabad.
So she.
Sambhavana.
Okay, so she comes to the clinic here
Yes.
as well.
Yes.
Okay, so that's. I think a lot of the staff here
Yes.
have either were affected or have parents or relatives who were.
About 23-24 staff is affected. Gas and community effect water exposure.
Right.
22 or 23.
23. And how many staff are there here?
60.
60 staff.
Yes.
So that's over a third of them then, isn't it?
Yes.
Yeah, that were themselves affected. And maybe that's what attracts you to work here. That's a question I
Yes.
love to ask you. Yeah, what attracts you? What keeps you here for nearly 11 years working here?
I am joining in 2009
Yeah.
in research department
Oh, you started there?
Yes.
Okay.
for data entry operator. Then I am joining 2015 registration department.
Came to here. Okay. So, what was the work in the it's upstairs. I'm pointing upstairs to,
Research
to
department.
people in the research department.
Yeah.
To people watching this who won't know, is straight above us in a room just above on the first floor, which is why I was pointing. So I apologise to my watchers, viewers, for that automatic action. So yeah, how did you enjoy the work in the research? Well,
I am enjoy research and registration department daily.
daily.
I'm happy.
Yeah, because you see face to face the
Yeah.
people coming, don't you?
But research department work and different. This work is absolutely different.
Yeah,
The peoples come in first time, face daily every type of peoples.
yeah.
So I'm happy this
I think
department.
having been in those two departments, you've probably got as good a feel as anybody of the conditions that we see
Yeah.
in the clinics. You know, because I hear that there's diabetes,
Thyroid.
some cancers coming.
Thyroid patient,
High blood,
hypertension,
hypertension, yeah,
thyroid
headaches,
also.
yeah, many things.
Some skin affected.
Really, yeah, yeah, and they're getting worse. Are they getting worse or? Yeah,
So I am working research registration department. Patient come in registration. So we choose
right.
different pathy. Because two type pathy in Sambhavana,
Right.
allopath and Ayurveda.
Yes, so they can choose whichever.
So I have treatment protocol.
Okay,
So we have choose in protocol
okay.
allopath, Ayurveda.
So they can choose either.
Yes.
And we've got Dr. Usha and Dr. Savodi. Is it now the new man?
Yeah.
Yes, and Dr. Raghuram and
And
Rupa's still here, but
yeah.
Rupa's leaving soon. So, and of course the gynecological.
Yeah.
Are there a lot of patients that come for gynecological issues?
Daily 10 to 15, 20 come in gynecologist.
Every day.
Every day.
With problems. I certainly read that is one of the big areas of effect over the years for women. You know, it's a major cause of problems. Yeah.
Yes.
Okay.
White discharge and PCOD.
Yeah.
So
Okay.
I refer to gynecologist.
Well, I'd like to thank you very much, and just to everybody watching this, I know Nicky has been very nervous for this interview.
Yes.
He told me how bad his English is, and I know his English is not bad. It's actually better than he speaks much better than.
I am nervous.
Yeah, exactly.
In front of you.
In front of the camera.
In
But,
front
you know,
of camera.
I'm really grateful, and I'm sure because the people that watch these videos and my friends back in the UK and other places, it's really interesting and good for them to see some of the people who actually work here I come, I flit in for a few months, I do some treatments and maybe help a bit, and then I go. You're here.
But I
all the
promise
time.
next time I will do work my English.
Okay, we'll start
I'm
a training
better English.
session. We'll start a
Next time.
training session. Okay, thanks very much, Nikki.
Okay.
And